were a lot of problems that arose during the COVID-19 pandemic. And one of the major problems that happened during this pandemic was the continuously increasing of teenagers who get pregnant. We Care organization was made to help teenagers be guided to avoid early age pregnancy. We Care organization prepared a presentation for everyone, especially for the teenagers, about the effect, impact, and ways to prevent the teenage pregnancy. Please stay until the end of the presentation.
In this slide is the mission and vision of We Care organization. Our mission is to educate everyone, especially teenagers, about the effects, impacts, and how teenage pregnancy can be prevented. Our mission is to help teenage pregnancy lessen and for the teenagers to be more careful of every action and decision that they will make. And our vision is to be one of the successful organizations to implement this advocacy regarding teenage pregnancy. We want We Care organization to be a well-known organization for us to reach those who need guidance regarding this situation. Our program about teenage pregnancy allows people to understand, learn, and have more knowledge on how to handle and provide awareness of the consequences of being pregnant at an early stage. We Care program talks about risk, effect, prevention, and lack of information about the common issue that teenagers are experiencing.
Now let's discuss some of the effects and risks of teenage pregnancy. First, it increases the dropout rate in school because of the pregnancy-related issue. Pregnant girls often to drop out of school, limiting the opportunities for future employment and perpetuating the cycle of teenage births result in health consequences. Children are more likely to be born preterm and have a lower birth weight and have a higher neonatal mortality, while mothers experience a greater rates of postpartum depression and are less likely to initiate the breastfeeding. According to the World Health Organization, adolescents mother ages 10 to 19 years old face a higher risk of eclampsia, puerperal endometritis, and systemic infection than women ages 20 to 24 years old. And babies of adolescents mother face a higher risk of low birth weight, preterm delivery, and severe neonatal condition, which could lead to maternal mortality or premature birth or stillbirth cases. And here are some effective ways to prevent teenage pregnancy. First is to provide a sex education to adolescents for the young adults to gain enough knowledge to be able to discern how will they handle themselves in making a decisions regarding their sexual health. The second one is the bullet quite has a similarity to the first bullet, which is to educate people who are in their teenage period regarding the topics about HIV, STDs, and contraception. These are the three of the main diseases teenagers might encounter without being sexually disciplined. Some experts says for that to avoid the transmission of the diseases, which was the condoms. Condoms on which HHS Office of Women Health had proven to reduce the risk of getting some STDs or even HIV. However, the word reduce is still bothering me. Here are some of the symptoms to be expected from having HIV, which are fever, headache, muscle and joint pain, rashes, sore throat, swollen lymph glands, diarrhea, and weight loss. While for STD, an unusual discharge from the vagina, pain when peeing, lumps of skin growths, a rash, unusual vagina bleeding, and checkup. Next is to monitor the influence of the media. For the most part, social media has taken a huge influence, provoking young people on wanting to try sex. It is all because of what they see and watch. It became and inevitable. Based on our research, the media or the internet has gotten to be one of the dangerous platforms for engaging in sexual activities. For that, the provided sex education can be a good help to reduce that from happening. The next bullet is to reduce forced sex. Forcing to have a sex with anyone that lacks interest in having it can have a bad effects on health. Lastly, talk about the health risks of unprotected sex and teenage pregnancies. Aside from providing sex education, it is also one of the effective ways to protect teenagers' body and sexual health is to talk it out one-on-one with someone who is older and haven't experienced.